guys, so today is a new edition of our Mental Health Mondays, and today we're going to be partnering up with Navpreet, who is a researcher at UC Davis. She's studying MPH, so we're going to see about her research, and Tanya is always going to be joining us, who is a founder of Championing Youth Minds, which is a mental health organization. So let me go ahead and add her.
Hello.
Hi.
Hi.
I'm
Can you
just
hear me?
waiting for. Yeah, I can hear you. Can you hear me?
Yes.
Okay. Hi. Yeah. I'm outside because I couldn't go get back to my hotel, so sorry for any noise. Let me know when it gets too loud and I can mute myself.
Yeah, for sure. No worries. Thank you so much for having me today.
Yeah, of course. Both of you want to introduce yourself?
I
You
don't
can
mind
go
to go
ahead.
first. Yes. Yeah, hi, I'm Tanya. I'm the founder and CEO of Championing Youth Minds. So Championing Youth Minds is a non-profit I've started up to help raise awareness about youth mental health and provide resources for young people. And yeah, would you like to introduce yourself?
Yeah, so my name is Navpreet Gill, and I actually graduated from UC Davis, where I did my undergrad. I
Wait, did she go for you too? Because I think her
Yeah,
internet is
yeah.
unstable. Let me add her again then.
Hi, sorry, I think it kicked me off. Sorry about that. Can you all hear me now?
Yeah, we can hear you now.
Okay, yeah. So I went to Davis for undergrad. I'm currently a Master's of Public Health student, also at UC Davis. And so, yeah, so I'm doing this research study that we'll talk a little bit more about. And yeah, that's just a little bit about me.
So I'm a researcher at Brown Women Health, and so my question is for you, Navpreet. Like, what proceeded you to do MPH?
Mhm. Yeah, definitely. So during my undergrad, I was a part of a clinic named BIPSHI. And so it stands for Bhagat Puran Singh Health Initiative. And so this clinic started in Sacramento. So it was a UC Davis and Sacramento State kind of collaboration. And so it grew throughout California, and there's a few across the country now as well. And so basically what we did is we would do clinics at Gurdwara, or Sikh temples kind of around our area. And so I think that was kind of the key for me of what got me into kind of community education, because a big part of what we did was health education. And so we spent a lot of time sitting down, talking with the Sangat members, the community members, and just talking about like health, mental health. We talked about physical health, heart health, and just there were a lot of things I think that the community was just misinformed about, or just maybe didn't understand. Maybe they didn't have a Punjabi speaking doctor, so there were a lot of kind of questions that people had, that we were able to kind of talk about with them. And so I really just fell in love with kind of that aspect of it, and so that kind of pushed me into going into public health. And so my end goal is to go into primary care as a physician. And so I see public health working very closely with medicine. And so for me, that was kind of, I knew I wanted to kind of gain some more experience, some skills in public health, so that I can use that as a physician. Yeah.
Yeah, I love what you said. I think especially like the way you said that there's not many Punjabi speaking doctors, which I feel like needs to improve so much because not everyone knows English, obviously. And I think basically expecting everyone to know English is wrong because it's like not everyone can learn it easily because English is not an easy language to learn. Like there's so many different ways to say one thing.
Mm-hmm.
And I think
Exactly.
especially like I wish we had more Punjabi speaking doctors and more like, Marathi speaking doctors. Like there's so many languages that need to have like more doctors like that speak, you know?
Mm-hmm. Yeah, definitely. And I feel like even beyond language, it's like a cultural thing as well. Like there's a lot of things that are hard to explain to someone that isn't, South Asian, right? Whether that's Punjabi, Gujarati, Tamil, right? It's like a lot of kind of little nuances about, religion or like our families, kind of our values, our culture, that's, even our food, right? Things like that that you have to, it takes a lot of effort to explain that to someone else, before you even get to that step of like, okay, now let's talk about my health. Like I feel like in public health, a really big thing is understanding, a person as, where they come from and their environment. And so without that understanding, it's really hard to connect with someone and then also be able to help them, you know. So yeah,
Yeah.
definitely great need.
Yeah, sorry, I'm just going to interrupt there. Yeah, I think it's the same in the UK as well. You want to build a rapport with your doctors, and when there's that language barrier and that cultural barrier, that's obviously, one hurdle to get with. And then even, high cholesterol, diabetes is so common in the South Asian community. And when you can't, talk about, food, food is plays such a big role in both diabetes control and high cholesterol control. And the fact that, maybe different cultural doctors can't even understand, what exactly goes into our, what we eat. I think things like that do really kind of change the quality of care we get.
Yeah,
Yeah.
definitely.
Oh no, go on.
Oh yeah, I was just gonna kind of tie this back into mental health. I think it's when you talk about mental and emotional health, something that's so already so personal, and a very vulnerable thing to talk about. So when you have that additional like language barrier or cultural barrier, it's just even harder for people to reach out and get help. It's just that process itself is already very difficult, and many struggle to reach out and uh, pursue professional support. And so having that kind of barrier as well of, will they understand what I'm saying? How do I word this to them and they don't understand my culture? Are they going to judge me? All those things are just even more kind of obstacles, in that path.
Yeah, I mean, I can kind of put my personal experience forward. So I suffer from fibromyalgia and Ehlers-Danlos syndrome, and it took me 4 or 5 years to get a diagnosis. And it was really hard to explain to doctors why my parents would think it's like nazar or something. The superstitions, it was really
Yeah.
hard to kind of communicate that point across and kind of why I was so mentally distressed. And I think, things like that do really impact mental health, especially if you're going, to talk about mental health, the stigma that comes along with it. It's kind of hard sometimes to communicate that to the healthcare professional that, you really want to understand your situation. So there definitely is like a lot of barriers that, do come our way.
Yeah, definitely. I can relate to that too because I think for me, I just started going to therapy this year, like, properly. And I didn't go because there was so much like, what if they don't understand how I feel? Or what if they give me like, options that I can't really do, like move out, whatever, like I can't do all of that, you know? There's so many things that like people, if you're not basically South Asian, you're not going to really understand.
Yeah, thank you for sharing that. I know, for part of my research, I did interviews with people, and that actually was something that a participant mentioned exactly what you just said.
Navpreet, I can't really hear you.
Sorry, can you hear me now?
Yeah,
Yeah,
perfect.
yeah, you're.
Okay. Yeah, sorry about that. So I was just talking about an interview participant that I was talking to, and they mentioned the exact same thing that you did about, talking to their therapist about some kind of family struggles they were having, and they suggested, oh, why don't you just move out? And she was struggling with trying to explain to them that that's not really like culturally accepted. That's not really a solution, for her situation. So yeah, I think what you just said is definitely something that other people are also experiencing.
Yeah, definitely. I think it's like we don't really get to unless it's like you have a South Asian therapist. You're very lucky if you do, because they understand you much better. I feel like because they've pretty much gone through the same thing. And I feel like because of the reason, like what I went through in my life, I want to be a therapist too because of that reason, so I can help somebody else, maybe better than like the help that I have gotten over the years. So it's like I think it's like when you have somebody who understands your culture or religion, whatever, like because religious trauma is such a big thing too. And I think when you have somebody that understands that, it helps so much.
Mm-hmm. Definitely. Yeah, and I think even just to kind of add on to that is when we're talking about like culture and we're talking about like our families and all these things, we talk about food, but also is I think really important, especially I'm kind of going to tie this back to the Punjabi community just because that's where my kind of research is focusing on is a history of trauma and like community trauma, intergenerational trauma, just from so many historical events that have happened in the past. And so I think it's so important to address those as well when it comes to mental health. And I think the interesting thing is, you know, people might not even realize how that kind of trauma has impacted them. Like they may not be able to verbalize that necessarily, but I think having healthcare professionals that can recognize that and even know that history to know to look out for the signs of trauma and things like that is so important. And so I think that's why we need healthcare professionals, you know, that are South Asian, that are Punjabi, or at least that can understand that history.
Yes, so do you want to talk a little bit about what your research is exactly about?
Yeah, definitely. So as part of my Master's of Public Health, my practicum project is doing a research survey in the Punjabi community of California. And so previously I had a mental health survey that was released. It was in English. Since then, we have closed that survey and now are actively collecting responses for the Punjabi version of the survey. And so we're specifically looking at adults that identify as Punjabi that are living in California. And so we kind of are trying to assess a couple different things. So one, we're trying to understand the mental health status of individuals. You know, what are the kind of what's the prevalence of certain mental health conditions like depression, anxiety, and we also ask about kind of barriers to care, if they've experienced you know issues with cost, issues with feeling comfortable with their healthcare professional, things like that. And then we also ask about their views. And so I think a lot of us can probably agree that, you know, mental health is such a highly stigmatized topic, you know, in our community, maybe even in your family. But there's no like quantitative kind of research on that. Like we all have our personal stories, I think, but we don't have it kind of written down somewhere of this is something that these many people are experiencing, you know, so this really is a legitimate issue. It is hindering people from accessing services and seeking care. And so that was kind of the goal of this research project was to quantify that information. And I do want to specifically emphasize why I chose the Punjabi community of California. Um, so if you look in the literature, you know, look up research articles on mental health, you'll find studies on like the South Asian community, Asian Indian community, Asian American community. But the issues really with all those terms is that they're very, very like big umbrella terms, right? So even the word South Asian, you know, so many different countries fall under the South Asian term, right? And even if you look at India, right, within India, there's so many different languages, so many different religions and ethnic groups, you know, so you can't really generalize the experiences of one, you know, South Asian person to another South Asian person, right? Because they could be living in different countries, completely different lives, you know? And so that's why I really narrowed it down to the Punjabi community because there is very little.
Should I add her again or should I wait for a minute?
Maybe Alper again.
I just sent her a request, so let's wait for it.
Hi, I'm so sorry. It kicked me
Hi.
off. It kicked me off again. I'm so sorry. It's probably my internet.
Oh no, you're fine. Do you want to continue where you left off?
Yeah. So hopefully everything. I was just talking about the Punjabi community and the lack of research in the community. That's just to kind of emphasize again why we're doing this research study specifically in this community.
So what is like one similar thing that you've seen over your research?
Mhm. Yeah, definitely. So, um, I can definitely talk a lot more about the English survey that we had out. I have been analyzing the results from that and kind of summarizing it. And we had 301 total participants. And out of those, I did 35 one-on-one interviews with people just to kind of get a more in-depth understanding of their experiences and, especially accessing mental health services. And so really the biggest thing that I found with the survey is we asked participants if there ever was a time that they thought that they needed a professional support but did not seek it. And we had about 75% of people say yes to that question. And so I think that was kind of the biggest like red flag that, hey, there are people out there that know that they need support. I've come to that realization, but for some reason are not seeking it. And so that was, I think, the most shocking and kind of heartbreaking finding. And so we kind of asked even more kind of questions about, what were things that you were concerned about when it came to accessing services. And the most common response was being afraid that, or being worried that someone else would find out, especially a family member. So being afraid that a family member would find out. We also asked about, some said friends, also employers or coworkers. So really this just highlighted that there is this stigma around mental health that, compared to like a physical health issue, right? Like if you break your arm or your leg, or something like that, it's not really seen as something that you need to hide from people. People I think are more open to talk about those things, but there's this fear of telling someone or having it be known that you go to therapy. There's kind of worry of what people will think about you, if it'll change how they think about you. And so that I think was the most interesting, not surprising finding that we had, but it was just kind of like, again, just a wake-up call that this is, when we talk about stigma, we kind of throw it out there, but it really is stopping people from seeking care when they need it. And so the second most common kind of barrier that people reported was not feeling comfortable speaking with a healthcare professional. And so we talked about that earlier. I think that's something across the board because, like I said, mental health is a sensitive topic. But when you add in that additional kind of layer of not having culturally competent care, not having, a South Asian therapist or professional, so that also can be another level of feeling uncomfortable speaking with someone that may not understand your background. And then the third common barrier, and actually like 50% of people said that they were concerned about cost. And so I think that's we have a whole nother talk about, the cost of healthcare and issues, when we talk about insurance, does your insurance cover your therapy? And that's just a whole nother kind of obstacle for people to get through when it comes to accessing care, and I think that is also a really, really unfortunate situation in which people know that they need to seek therapy, but, they don't just because of cost, just because their insurance isn't going to cover it. And so that's, someone in the live is saying that mental health should be a basic right, not a luxury. It is one of those things that, people that come from a lower income background that are disadvantaged are put at a even greater kind of disadvantage, I would say. It's even more difficult for them to access these services. So yeah, I could keep going. Was there anything else you all wanted to add about kind of what I've been finding in this research? Any comments you all have?
Yeah, I really agree with the fact that you said that like we really need to help like lower the cost of therapy because it should be accessible because like so many people go through so much, and I feel like therapy shouldn't just be for if people that are struggling. It should just be there.
Mm-hmm.
Everyone needs a therapist, honestly. Just like you need to go to your doctor, you need to go to a therapist. Because I
Mm-hmm.
feel like when you have, like you said, when you go through something physical, like you break your arm, you're easily like okay with going to a doctor. But when something's wrong with your mind, when something's wrong with the way you're thinking about yourself or about things like that are around you, like trigger warning, but suicidal thoughts, you need a therapist. And I don't think going to therapy is a bad thing. You should be able to go there without having to think that your family's gonna judge you or your friends are going to judge you.
Mm-hmm.
Because if you need help, you need help.
Yeah, exactly. And then I think when you add in all those factors together, right? So I just want to briefly share a conversation I had with one of the participants that I interviewed, without disclosing who they are. But I had this conversation, and she was talking about kind of she knew that she needed therapy, right? She kind of came to that personal acknowledgement that she wanted to seek therapy. But when her first concern was, okay, I don't want my parents to know about it, and that's all it comes down to, like the stigma, the not knowing how to explain what therapy is, afraid that you may be judged, right? So the stigma aspect of it is there, right? So that's kind of the first barrier. And then the next step was, okay, if I don't tell my parents, I can't use their insurance, how do I would have to pay out of pocket for therapy. And then this individual said, well, I don't have that kind of, cash, that I can just pay on my own for my therapy sessions. And so then that's where the cost factor comes in. And so it's like these multiple barriers that are, at the end, it's like, what do you do, right? And then with COVID, right, everything kind of went online. And so, you know, that is just a whole, like, completely changed the game with mental health, and mental health services is now doing virtual therapy, right? But if you're in a household or in a family where you're living at home with your parents, and if they're home, you may not have that ability to go onto a video call or a phone call with a therapist and talk about things, right? You may not have the privacy. You may not feel comfortable doing that, and especially if it's something that you don't want your family to know, how do you kind of jump through those hoops, of hiding that from other people? So it's like these, literally, just getting to therapy for some people is just so difficult. It's not just one thing that they're trying to kind of figure out. It's multiple things that are stacking up really against them. And that's the most, though, I think those individuals are in the most vulnerable state, and really isn't that's the most unfortunate situation that I think we need to address.
I mean, I
Yeah.
totally agree with that. I think there's also the problem is that, sometimes when you go into kind of deeper rooted issues to do with your childhood and stuff, is that guilt, you know, is this pointing fingers at my upbringing? Is this pointing fingers at my parents? And I think that can definitely be quite that type of conversation is something you can't really sit down and have with your parents. And also, I was just kind of curious, did you really find any findings to do with religion? Because I know personally, like my parents have said, just believe in God, like go to the Gurdwara, like you'll be fine, do part. So I was just wondering if there was any like connection there.
Yeah, I did. So the survey, we did ask individuals if they look to their religion for support. And so we did have a good number of participants that said yes to that. But in more detail in the interviews, I did have a good number of participants bring that up. That, when I asked about what are your family's views on mental health, or your experience talking to your family about mental health, a lot of times they were told, it's going to be fine, it'll go away, just pray more, go to the gurdwara, do bat, right? And I was having a conversation with a participant that said, yeah, like that does help. It's not to say that religion can't be a strong support for many people. It is for a lot of people, but for some individuals it's just not enough. And so for some individuals, they can pray, right? They can do bat, and that's great. but they might need that extra push, right? They might need that, you know, therapy sessions. They may need medication, right? So it's really not like a one size fits all when it comes to mental health, right? You know, you can't just tell someone, oh, just do this, you know, and you'll be fine because it worked for me or it worked for someone else. And so I think definitely religion does play a big role, especially, you know, in our culture where it is really, really important. But I think it's understanding that, you know, just because it doesn't, if someone needs something more, it's not to say that they don't care about their religion or there's something, you know, bad about that. You know, someone can be very religious and still need that extra support, right? So I think that's also a thing that people are worried about. I've had conversations with people and also in the interviews with some participants that there's this kind of misconception that those that are very religious can't have depression, they can't have mental health issues, just due to the fact that they're very in touch with their religion, or they're very, you know, spiritually in touch, right, with their religion. But and that's another kind of issue, right? Is that kind of taking down that misunderstanding, that misconception.
Yeah, I think, you know, then that really kind of brings the question of, do we need, you know, priests, bhakti, like the people running these religious institutions to then advocate mental health awareness?
Mm-hmm. Yeah, actually, I did ask participants a question at the very end. I would ask, you know, what kind of things do you think that we need to do to improve, right? Like what program should we do, things like that. And a lot of people, like vast majority of people said there should be something at the Gurdwara, you know, in a religious setting, to kind of normalize mental health too. You know, having something, like having a presentation or just having, you know, someone there to like give information to people on mental health, whether that's like pamphlets or anything, but having it in a religious setting would help people feel more comfortable and feel like, hey, this is not something that's like inherently a bad thing. You know, mental health is something that we should be talking about. And that having it in a religious setting kind of does help with that notion of, you know, just because you're religious doesn't mean that you don't need mental health services or that you don't struggle with your mental health, right? Mm-hmm. So that was a great point. Thank you.
Thanks.
Mm-hmm. Yeah. Yeah. Were there any other questions? I could go on about some of the conversations that I had with individuals, and it was really, I think, really helpful to hear, you know, some of the personal stories of individuals and what they're going through when it comes to just the mental health and the things that they hear about, you know, in the community, the different ways that stigma kind of presents itself. One really thing I just kept hearing over and over was this idea of keeping it hidden, you know, in the family. Even if you talk to your family members, their participants, you know, their family members knew that they were struggling, that they're seeking treatment, but and they would come to an understanding of, okay, you know, we recognize that you need to see a therapist, that you're taking medications, right, and that's fine, but don't make sure no one else knows about it. You know, very strong on, okay, we know about it, but keep it in the house, keep it in the family. Don't tell your friends, don't tell other relatives, right? Because we don't want people talking about us. And it just comes back to this like reputation issue. This, what I would say is this overimportance set, if that's even a word, on reputation and presenting yourself in a way that's always positive, and you know, you don't want to show any weaknesses. And so I think that's something, and I'm sorry if I'm rambling, but I think that's something that's on a personal level as well. When you struggle with your mental health, I talked to participants that said, you know, just that personal, getting to that personal realization that I should talk to someone about what's going on and accepting that. There was that thought of, am I just not strong enough to get through this, right? That they feel like they're showing a weakness to someone else by saying that and admitting that and being vulnerable. So I think that's an issue at a personal level, but then when you amplify that to like a family or community level of, mental health is seen as a weakness, and so people internalize that, and they don't want to talk about those things with other people.
Navpreet, there's a question for you. Let me see. Can you see it on the screen? Okay, the question is, do you have any findings about the influences from the outside the Punjabi community? For example, the ideals of Western body image and its impact on mental health?
Got it. So influences from outside. So not in the, so again, our survey, it's very hard to ask a lot of in-depth questions, which is why I really, really enjoyed the interviews and where I hear people's experiences. And I did hear stories of, well, a lot of the participants were first generation Americans coming from immigrant families. And a lot of them did comment on the kind of, like that battle, that kind of internal struggle of being South Asian or being Punjabi specifically, but also being American and being raised here, and kind of the conflicting ideals, right? And so I'm not sure if that by Western, I think of Western influences, growing up here, there's a lot of importance placed on being independent, right? Having your personal freedoms, exploring who you are as an individual. But when it comes to Punjabi culture, and I'll speak about Punjabi culture specifically, is it's very collectivist kind of society and culture where your family is really most important thing, right? And there's a sense of obligation that you have to your family. Especially when I talked with many young women in the interviews talking about their expectations as being a Punjabi female, being a daughter or a sister, that they had certain expectations that they were supposed to meet, right? And they talked about how that conflicted with kind of the Western ideals of an individual and kind of the American ideals specifically of, you should have these freedoms, you should move out, right, when you're 18, right? That's things that they're seeing other people do, but it's just different when you come from a Punjabi background. So does that kind of answer that question, or does anyone else want to add to that?
Yeah, I agree. I think it's like, yeah, I agree. Sorry about that. Yeah, I agree. I think it's just Western ideals, especially like, the question also say body image, which I feel like is such a big thing for us, for in our community, like South Asian, Punjabi, like whatever community, it's such a big thing because there's always that you have to be size 0, which there's nothing wrong with being size 0, but then again, there's nothing wrong with being size like, 12 or 14. You can be whatever size. It's just, I think it's all about health. You just need to be healthy. You can like be the skinniest person ever, but you can be unhealthy.
Mm-hmm.
So I think it's just like body image. It's like so many of us have body dysmorphia because of what our families have said to us. Like, oh, you don't look good in this dress, or you don't look good in this outfit. Even if you like that outfit, you're gonna be like, oh, I don't look good in it. Let me just throw that away.
Mm-hmm. Yeah, definitely. I did, sorry, I missed the body image part of the question, but that is such a good point and so important to talk about. And again, I'm referencing back to these interviews. And, it seems like it wasn't a lot of people, only 35, but people did I did have someone bring up body image, and especially talking about how, in her family and in her community, it wasn't necessarily explicitly stated, but they talked about how the connection between skinny and pretty, that if you're skinny, then you're automatically considered to be pretty, right? And to be pretty, you have to be skinny. And it was like this set in stone kind of standard. And so this individual talked about growing up, a lot of her cousins and family members were just always bringing up the idea of dieting and, I need to lose weight just constantly, I need to just be smaller, I need to be skinnier. And, the comments that I think maybe some of us can relate to as well, hearing from other family members, they may not be intended to be harmful, but, the comments when you're out somewhere at a family event and someone comments that, hey, you know, it looks like you gained weight, right? Or, hey, like, oh, you lost weight, that's great. And so we start kind of internalizing all of those things and associating, again, like that participant said, skinny is pretty. And that is so, so damaging, right? Because like you said, we all know that's not the best indicator of someone's health, right? And it shouldn't be the sole indicator of someone's health, you know, by their weight. And so I think that's a Western thing as well, but also like something in the Punjabi culture as well, is especially expectations for girls and for young women to look a certain way. And so one thing that kind of occurred to me, you know, participants have told me, and I'm just remembering bits and pieces here as I'm talking, but this importance on marriage. And again, when it comes to body image, I had conversations with individuals that talked about, you know, this like idea that girls need to be ready for marriage at a certain time, and so that's why you need to look pretty, right, to get married, right? And again, that reflects on the family, you know, the way that you look. And so again, that's just emphasizing this, you know, importance on body image and these like standards that people have. And so the last thing I want to mention, just with Western influence, is also, I think, an issue. And again, this can be a whole separate conversation on colorism. And so that is where I can see a big influence of Western, like Eurocentric beauty standards that we see in South Asian communities to this day. This kind of preference, like social preference of being lighter skinned. And we see this in advertisements, in beauty products, you know, makeup products, that there's this standard that, you know, you want to look lighter in your skin tone. And these are things that are just perpetuated through our community. And so I think all those things kind of all together, you know, can be considered with body image.
And I have another question for you. How do you think, like in the Punjabi community specifically, we can normalize mental health?
Mm-hmm. Yeah, so I think that is really the hardest thing, but really the biggest problem is normalizing mental health, getting rid of that stigma. And so I think it comes from multiple sources. There's multiple levels to that stigma. And so I think with normalizing it, the first thing I think of is just starting within your family, having conversations with each other about mental health, right? And making it a topic that's considered to be, you know, something that is normal to talk about on a daily basis. You know, the same way that you
Navpreet, I think you're gonna have to leave and join back because it's not letting me add you again. Okay, I just said hi. Okay, hi.
Hi, I'm so sorry, but I'm not sure why it keeps kicking me off. I'm so sorry. Can you all hear me?
Yeah, we can hear you.
Yeah. Oh,
Oh, I think her internet.
Yes, can you hear me?
Yeah, we can hear you.
I never have internet issues until of course today I have internet issues. Yeah, so okay, you can hear me now, right?
yeah.
Okay, awesome. Sorry about that. So just talking about normalizing mental health again, I think starting within your family, having those conversations and making it clear, you know, that this is a safe place to talk about those things. So I think it starts by having, you know, parents talking to the kids about mental health and letting them know that it's okay to bring up your feelings, right? And I think that's another thing and I'm generalizing, and this is not the case for every family, but Punjabi families, talking about your feelings may not be a very big thing, right? You talk about school, work, things like that, but having conversations about really what's going on inside and sharing those with your whole family, I think is not something that everyone can do. And so having those conversations, and also having education, educating people on mental health, there are still a lot of misconceptions. And I know it's, the common ones of not understanding where mental health issues come from. There are individuals that might believe that mental health is caused by different things like supernatural things or other things, or misconceptions that, if someone has depression, oh, that's something that can be solved in a day. If, for example, if they pray, understanding how treatment works, understanding what therapy even is. I know I've talked to individuals that are just like, oh, well, what's the point of therapy? You just talk to someone. But it's not just talking to someone. And I think, Nimra, you mentioned at the very, very beginning, this idea that therapy is not just for people that are struggling. It's not just for people that have severe depression. This is something that everyone can benefit from and learn from, right? And the tools that therapy can give you are things that everyone I think can benefit from. So I think normalizing that, and not seeing treatment as such a bad thing, and especially when it comes to medications. I talked to participants, and they talked about how their family was very against taking medications for mental health. There was this fear of addiction to medication, or the side effects of medication, or that's something that you have to take for your whole life, right? But when it comes to, for example, someone with diabetes, they're going to take their diabetes medication for probably the rest of their life, and it's a normal part of their day, and no one really questions that, right? It's like, okay, you have diabetes, you're taking your metformin or whatever, you need to take that every day, right? Don't skip it. But when it comes to sometimes someone with, and I use example of depression, but this could be for bipolar, for anxiety, some people have this misconception that, okay, they just need to take it for a week or two and then they'll be cured and then that's fine. But for some people, that's not how it works, right? Some people do need to take medication long term, right? And so I think seeing it kind of, and I'm making connections with physical conditions, not to say they're one and the same, but understanding that, hey, the way that this is normal and completely acceptable, I think that's the same way that we need to see mental health, right? That this is just something that someone has that, they're getting treatment for, and that's that, right? There's no need to be ashamed of it. There's no need to vilify it, right? Or make it a big deal. That's just something that someone needs, and the way that they're coping with their health, right? So mental health is health. So yeah, I think there's just so many different ways to go about this, and when it comes to normalizing mental health.
So one of my other questions for you is, what have you personally learned after doing this research? How did your thinking basically change after doing it?
Mm-hmm. Yeah. So going in to this project, I kind of knew, not knew, but I had experience with stigma behind mental health, and so like I mentioned earlier, we all kind of know that mental health is stigmatized. We've heard of it, we've seen it. It's like we all have this understanding that mental health is stigmatized. So going in, I knew that, okay, I am going to see that reflected in my findings, right? So I kind of had that in understanding. But I think I was shocked at how, like I mentioned earlier, how that stigma translates to people not accessing services. So I went in thinking, yeah, mental health is, something we don't talk about in our community. People have these views or maybe misunderstandings, but seeing people, and listening to people's stories of that was the reason why they couldn't go to therapy, even when they knew that they needed or wanted therapy. Not being able to access that service because of the stigma, I think to me was kind of the wake up call, and like that biggest kind of heartbreaking also finding is that that stigma has tangible consequences. And it's not just a matter of, yeah, people are uncomfortable talking about mental health. It's more of, mental health conditions do exist in our community. You may not hear about it, right? You may not have the statistics. We don't actually really have statistics for the Punjabi community and what the prevalence is of depression, anxiety, or bipolar, PTSD, any of those things. We don't have that, but it kind of just made me realize really that, those things do exist, right? Depression can happen to anyone of any culture, any, language, religion, background, whatever, right? We know that those conditions persist in any community, and kind of seeing the numbers of these many people saying, yes, I do have depression, right? People aren't talking about it, but people do have it, and people are struggling. And seeing, especially today's age, you think, oh, everything's modern, everyone knows everything, right? Technology is advanced. This isn't an issue, right? People, if they need therapy, they can go get it. But that's realizing that no, like there are so many barriers. We talked about cost. The stigma of reaching out is still very much there. The fear of people knowing is very much there. Family pressures to not seek care, are very much there. And so seeing the number of people, living in California, a lot of these individuals, a majority of them were born in the United States, right? And so seeing that these individuals still are suffering the consequences of stigma was, I think, the most kind of eye-opening finding from this research for me, and kind of changed my understanding and the way that I saw this as well.
Yeah, I think I love that, and I hope that your research, you're doing it in Punjabi now, right?
Yeah, so it's in Punjabi right now, and so the survey actually, the official closing date is today. So today is the last day that we're collecting responses. So yeah, it is fully translated into Punjabi. So our English survey, our average age of participants was like 25, and so now we're trying to reach, some of the older individuals in our community, kind of a different demographic of people that their primary language is Punjabi. And so that's where we're really trying to kind of gather information on that end as well, and to see if there's any differences in viewpoints, differences in experiences between those two demographics. And so, yeah, so it is open to the end of the day today. And I saw that you all posted the flyer on your Instagram page as well. And so if anyone is interested, the link is also in my bio.
Yeah, if anybody's eligible, they should definitely check it out and take it, because I think it's just gonna create so much more demographics and so much more statistics, and basically help us find out and realize how we can change, because like you said, everything starts in our own house. You can start by talking to your parents or little siblings or your grandparents, and that can change so much.
Exactly, yeah. And I just want to say this again, of kind of the importance of this research. I know talking to people, we got this question a lot, especially with the Punjabi survey. We've been tabling at different Gurdwara the last few weeks. So I've been, this whole survey, this whole project has been done in collaboration with a Lodge Clinic. It's a free Punjabi community clinic that's based in Sacramento, California. And so we were trying to do a lot of outreach to different Gurdwaras and reach, especially Punjabi speaking individuals. And we got the question a lot of, okay, well, what you're collecting these responses, it is anonymous and all that, but what's the point of collecting that data? What is that going to do for us? And so really understanding that this data does not exist for our community. And so once we have that first starting point, then we can, we have the evidence to show that these barriers exist. And from there, we can develop programs, we can develop resources for Punjabi speaking individuals, or just individuals from a Punjabi background, right? understanding that the barriers they're facing and trying to come up with solutions to address those. But until we don't know, we have our personal stories, right? But until we don't know, hey, this percentage of individuals have this problem, this barrier to care, we can't really develop anything to fix that issue. And so that's what I'm trying to just emphasize to people, is that it is just, on your end, just one survey. It takes about 15 minutes to complete. But please do have your parents, your relatives, anyone that is Punjabi speaking, fill it out, because the more responses we have, the stronger connections we can and conclusions we can draw, and the stronger our research will be when it comes to future projects and resources to develop. So that's my little plug for the survey. So link is in my bio. Please do share it. Again, today is the last day that we are collecting responses.
Yeah, please check it out and take it if you can. And thank you so much for being here. Sorry about that. I just phone glitches sometimes. But thank you so much for being here, both of you, for taking time out of your own day. And yeah, this conversation was amazing because, like, I think gave me so much insight, and especially like hearing so much from you, Tanya, because like, your whole championing youth minds is amazing. And I love your research, and I can't wait to check out the Punjabi version. Like, yeah, so thank you so much for being here, both of you.
Yeah, thank you so much for having me. I apologize for my internet issues, but thank you both, for this conversation.
No, thank you too. Like, it's really insightful and it's just so necessary. So yeah, it's amazing what you're doing.
Mm-hmm. Thank you so much.
Bye.
All right, bye everyone. Have a great day.
Bye.
Thank you.
You too.